Hello friends, welcome back to Complete Medical Coding. Today I'm here with some practice questions from the 50,000 series. As you already know, 50,000 series consist of urinary system, male and female genital system. Okay, so these are the topics which are covered under 50,000 series. So today let's discuss few guidelines and some practice questions. There was some delay in the videos because of my health issues. I couldn't speak much. Apologies for that. Anyway, let's move to the questions. So moving to the first question. A patient presents with cervical cancer. It has spread and metastasized throughout the pelvic area. She receives a total abdominal hysterectomy with bilateral salpingo-oophorectomy, cystectomy, and creation of an ileal conduit and partial colectomy. What are the CPT codes reported for this service? Okay, so here the patient is here with the cervical cancer. What are the procedures carried out? Hysterectomy. Okay, hysterectomy means, what does hysterectomy mean? Hysterectomy with bilateral salpingo-oophorectomy, cystectomy, and then colectomy. All this has been done. So hysterectomy means removal of uterus. Hysterectomy. Hysterectomy means removal. So hysterectomy means removal of uterus. Bilateral salpingo-oophorectomy means removal of, since it is bilateral, both. Okay, removal of both the ovaries and the fallopian tubes. Colectomy, removal of colon. So let's see. Let's look into the codes one by one. Okay, let's look into the codes one by one. Options. What is the first option? First code. See, I had already taken 50,000 series. You can open 50,000 series in your CPT code book. Go to the first option, first code 58150. I'm so sorry, friends. I'm still not well. Still, I thought of putting some practice questions for you. Okay, hysterectomy procedure 58150. The first code is 58150. What is 58150? Total abdominal hysterectomy. With or without removal of tubes. With or without removal of ovary. That is 58150. What is 51590? The second code in first option, 51590. That comes under urinary system. 51590. 51590 cystectomy. Complete with uretero-ileal conduit or sigmoid bladder, including intestine anastomosis. So we got hysterectomy, cystectomy, and what is 44140? 44140. You can also search along with me, okay, if you have the code book in front of you. 44140. Sorry. Double 4140 is colectomy partial with anastomosis. Yes, we have colectomy also. So what are the procedures carried out? Those codes are already mentioned. Still, we will look into other codes, other options as well, because sometimes there will be combination codes. So even though you got the correct CPT codes, you need to check the others also. Okay. So option B, first one, 58152. What is 58152? Same, total abdominal hysterectomy with colpourethral Laparoscopic. Colpourethrocystospexy. No, we don't have anything mentioned. Colpourethro, no, it's nothing mentioned, right? So that option will be wrong. Again, if you go to option C, the same codes as mentioned in option A, 58150, 51590, 44140, and then additional one more code 58720. 58720 is salpingo-oophorectomy. Salpingo-oophorectomy. That is the last code. And then what is the final option? Option D, 58240. What is 58240? 58240. Pelvic exenteration for gynecologic malignancy with total abdominal hysterectomy or cervicectomy, with or without removal of tubes, with or without removal of ovary, with removal of bladder and urethral transplantations, and abdominoperineal resection of rectum and colon and colostomy or any combination thereof. See, this is why I told you need to check all the options. This code contains all the removal codes. Everything is combined in this code, right? Abdominal hysterectomy is there. Then with or without removal of ovary, without removal of tubes, that means salpingo-oophorectomy. With or without is mentioned. So if it is with, it means if salpingo-oophorectomy means it's is there, it means it is with removal of tubes, with removal of ovaries, everything is there. So salpingo-oophorectomy is also there. Then with removal of bladder, again, cystectomy is there. Okay, and urethral transplantations. Then what else? Colectomy, that is also there. Colostomy. See, resection of colon, rectum and colon. So it means it's a combination of all the tests carried out. So the correct answer here is option D. Okay, 58240 is the correct code. All right. So that's why, even though if you got all the answers, all the codes in the first option, you have to go to the other codes. Okay. Check for the other codes as well. Now let's move to second question. Patient is status post radical retropubic prostatectomy with erectile dysfunction, presenting for penile implant. An inflatable penile prosthesis is inserted. What CPT code is reported for this service? So here, what is the procedure? Post radical retropubic prostatectomy. Okay. So let's find out. This comes under urinary series. So go to urinary chapter. First option 54400. No, this is not under urinary section. This is, sorry, male genital system. Yeah, erectile dysfunction presenting for penile implant. They are going to do penile implant. So this is male genital system. Okay. So 54400. What is 54400? 54400. Insertion of penile prosthesis, non-inflatable. Here it is inflatable. So this is wrong. An inflatable penile prosthesis is inserted. So this is inflatable penile prosthesis. But 54400, that is non-inflatable. Second code 54408. 54408 is repair of components of a multi-component inflatable penile prosthesis. Repair. No, this is not repair. This is insertion. In our question, it is insertion, not repair. So that's wrong code. Option C, 54416. Removal and replacement of non-inflatable or inflatable penile prosthesis at the same operative session. Removal and replacement. Here, there is no removal, there is no replacement. A new prosthesis. Nothing mentioned about replacement, right? So, insertion of prosthesis, penile prosthesis. So this is also wrong code because it is mentioned as removal and replacement. Now what is 54401? 54401, this is the code that we need. Insertion of penile processes, inflatable, self-contained, inflatable penile processes insertion. That's what we need. So answer here is option D, 54401. Okay. Now, third question. A partial cystectomy is performed due to the prior administration of radiation. It is complicated due to extensive adhesions and required an additional 2 hours beyond the usual cystectomy procedure. What CPT code is reported for this service? Yeah. So, what procedure is carried out? Cystectomy. Removal of urinary bladder. Cystectomy means removal of urinary bladder. Okay. So, a partial cystectomy is carried out. Okay. And then, after some time, due to complications or due to extensive adhesions, additional 2 hours is required beyond the usual cystectomy procedure. So, in that case, what you should code? That's what we need to find out. What's the first code? 51550. Yeah, option A, 51550. Take 51550. Cystectomy partial. It's just mentioned as cystectomy partial simple. This is not simple. Our question is complicated, right? It's complicated. What is 51555? Cystectomy partial complicated. Yes. Example, post radiation, previous surgery, difficult location. No, post radiation. This is because of post radiation. It is mentioned due to the administration of a prior radiation like that. So this is post radiation. Okay. So 51555 is cystectomy partial complicated. So that is what we need. Now what is in option C? Again same 51555 with modifier 22, and option D the same code as in option A, 5100 with modifier 22. What is modifier 22? Modifier 22 is an additional work that is not typically part of the procedure, but it does not qualify for its own procedure code. It means it's an additional work that is carried out, but it is not belonging to the procedure that is currently going on. In that case, you have to append modify 22. Here it is the same procedure. It's not a different procedure. So you don't have to code you don't have to add any modifier to this code. Okay. So as we said, the correct answer will be option B, 51555. 51555. Partial cystectomy, complicated. Okay. This is a simple question. Now, fourth question. A 25-year-old woman's regular obstetrician delivers her twins. The first is delivered vaginally, but the second is delivered by cesarean delivery. Both are delivered without complications. Patient will return in 2 weeks for a postpartum visit. What are the CPT codes reported for this service? So again, this comes under female genital system. Okay. So here what are the outcomes? What are the codes that you need to code? Twin delivery. In that, first is delivered through vaginally, second delivery through cesarean, delivered through cesarean. Okay, and no other complications. Only that you have to code. And then patient will come in, that is just for a follow-up, it's mentioned. It's a postpartum visit, patient will return back in 2 weeks like that. So, we can go to the codes, options directly. 59400, what is option A? 59400, routine obstetric care, including antepartum vaginal delivery and postpartum care. This is the one of the global code, okay? 59400. There it's mentioned, vaginal delivery. What is 59514? See, there is a guideline for coding. Okay. If here in the question, since it is a twin delivery, first is delivered vaginally, second is delivered cesarean. So whatever no complications here, but whatever is the priority or the, what do you call it, a difficult phase or a most important or a complex phase has to be coded first. So the first code always should be cesarean delivery code, and then the second should be vaginal delivery code. Okay. So first option is wrong because 59400, that means it is a vaginal delivery. In option B also 59400, the vaginal delivery, wrong option. Okay, so like this you can skip out the options directly if you know the guideline. What is option C? 59510. That's also another global code. 59510 is routine obstetric care, including antepartum care, cesarean delivery, and postpartum care. Yes, cesarean delivery. This code we need. But that is not the only code for the answer. So option C is also wrong. So obviously your answer should be option D. But let's check what it is. Same cesarean delivery code first, 59510. Okay, routine obstetric care, including antepartum, cesarean and postpartum, cesarean delivery and postpartum care. Same first code, then followed by 59409, followed by vaginal delivery. Yeah, 59409 is vaginal delivery. Vaginal delivery only, because already antepartum and postpartum care is there in the first code. So 59400. Second one should not be 59400. Okay. So 59409 should be the second code. So 59409 should be appended with a modifier 51 to mark it as multiple procedure, because this is a multiple procedure. Okay. One normal delivery and another cesarean delivery. So it's of course it's a multiple procedure. So here answer will be option D, 59510 and 59409 with modifier 51. Okay. Now moving to the fifth question. A 25-year-old woman presents with sudden left lower quadrant, LLQ means left lower quadrant, pain, which does not resolve. The decision is made to perform exploratory laparoscopy, revealing a cyst on the left ovary. The cyst is removed along with a partial oophorectomy. What are the CPT codes reported for this procedure? Yeah, so left lower quadrant pain. Patient is in left lower quadrant pain. And then what is going to perform? To remove a cyst on the left ovary. Laparoscopic removal. Okay, the cyst. Anyway, let's find out the answer. It is option A, 49320. What is 49320? Laparoscopy, abdomen, peritoneum and omentum diagnostic, with or without collection of specimen, by brushing or washing. Laparoscopy, abdomen only mentioned. What is 58925? 58925. Ovarian cystectomy, unilateral or bilateral? Okay, let's look into the other codes also. Option B, 58661. What is 58661? Laparoscopy surgical with removal of adnexal structures, in bracket, partial or total oophorectomy or salpingectomy. Yeah, partial or total oophorectomy. Yes. So here laparoscopy surgical is carried out with the removal of partial oophorectomy. It's mentioned in the question, right? The cyst is removed along with partial oophorectomy. So laparoscopy with the removal of oophorectomy. So this code should be there in our answer. Okay. So the same code is used in option C. So let's find out what is option C, the other code. Same, 49320. Again, laparoscopy surgical. So no need to mention 2 times laparoscopy. It's already there in the first code. So that option is wrong. And option D is also wrong, 58925. We already checked what is 58925. What was that? 58925. Ovarian cystectomy. No. So that's also wrong. So the correct answer here is option B, 58661. Okay, laparoscopy surgical with removal of adnexal structures, means with removal of partial oophorectomy, partial or total oophorectomy or salpingectomy, whatever it is. So option B is the answer, 58661. Okay. So friends, these are few important questions, practice questions from the 50,000 series. Hope you understood. If you have any queries or comments, please mark it. Please mention it in the comments. And I'm getting many feedbacks from many of my students saying that they have passed the examination. Recently, I got many even calls and some comments also from many of the students. So I believe it's all my videos are useful for the preparation of examination. Okay, those who have already passed the examination can also watch my videos, because in between I'm putting and I'm going to put also many important interview questions, and it will be very, very important, and it will be very helpful for your career. I'm telling you, it will be much more helpful for your career. So those who had already passed the exam should watch, okay, at least in between. If you find the videos regarding the interview questions, please come and watch it. It will be really helpful to you. Okay. So anyway, in the next episode, I'll be coming with some interview questions which is related to anatomy, which is related to medical terminologies, anatomy and everything. So hope you like today's video. And I really apologize, friends, for being delayed in putting my videos. As I told you, I was having severe health issues because of this cough. So anyway, stay tuned, friends. Stay tuned for more videos. If you are new to the channel, please subscribe. And thank you so much for all your support. Thank you so much for all your positive feedbacks. Okay. So see you in the next episode. Bye. Take care.